Hello everyone, I am Dr. Mukesh Mehra, Director and Senior Consultant, Department of Internal Medicine, Max Super Speciality Hospital, Patparganj, East Delhi. Today we'll be discussing about a very important disease of day-to-day importance, hypertension, which has taken a shape of epidemic in present world, and its incidence is to the tune of almost 50% in the adult population. And almost the worst thing is that 50% of population are not aware about its existence. Hypertension, as the name suggests, hyper and tension. There is something which is increased, the tension which is increased. So hypertension is defined as the pressure which is created by blood while flowing through the vessels. So the problem with this disease is it is a silent killer. So most of the patient, they are normally asymptomatic. It is just detected during your normal day-to-day physical examination or medical examination through your medical doctor or healthcare provider. It is very important to understand the risk factors responsible for the predisposition of a patient for hypertension, or for that matter the risk factors which are responsible for development of hypertension in population. Age is a very important criteria. Elderly people, especially above the age of 40, the risk increases very high. And then the sex. It is very common in male population, but the females are almost equally responsible and they are predisposed. As far as diagnosis of hypertension is concerned, it should be through your regular medical examination. It is only your health provider would diagnose it. Once it is diagnosed, it is not the one reading which is important. It is the two readings in the different timings of the day, and in the also if it is to be diagnosed, then it should be taken in both the arms also. And there are certain protocols which has to be followed while taking blood pressure. It is not a casual method by you can take it anywhere by anyone. If you are taking in a sitting posture, then you have to be in a chair comfortably sitting, and if you are using a sphygmomanometer, then it should also be properly tied also. It should be properly placed at a place where it is designated. So now we'll talk about management part, which is very important. So every disease management has got few things which you are always take into consideration. First, understanding the cause of the disease. So there are certain factors which are modifiable, there are certain things which are not modifiable. So ethnicity, geneticity, they can give you a clue about your predisposition to disease. If your parents have hypertension, if you have got a very strong history of many people in family hypertension, be cautious. You have to be proactive regarding hypertension. So control starts with prevention. So first thing is knowing your disease is the first step, and which is most important step. So here start with the lifestyle modification. So here you have to control salt intake, which is very important. If you are a smoker, then a big no for tobacco in any form. If you are associated diabetic or any other chronic disease, then you have to control that disease as per the designated range also, whether it is diabetes or it is your cardiovascular disease or it is a respiratory disease. And then comes the alcohol, which is a big nuisance actually in a nowadays lifestyle. So you have to be, if you really want to have it, then it has to be in moderation, which has got a definite permitted limits. But for all practical purposes, if you are a hypertensive, then you should avoid taking alcohol. And then if you are obese, then obesity, you have to cut down your calories also. You have to reduce your body weight, and to begin with it is 8 to 10% of your body weight, and then try to bring your BMI as close to 25 as possible. After lifestyle modification and taking care of all your risk factors and modifying your lifestyle, then you move on to medical management, which is available now everywhere. So it is always a stepwise therapy. So you always start with one drug if you are a moderately severe hypertensive. Now new suggestions suggest combination of two groups of drug. So they have got synergistic action also. There are two different methodology of giving a better blood pressure control also. So besides knowing your disease, lifestyle modification through your risk factors, and if you have other comorbidities like diabetes, cardiovascular disease, asthma, of pre-existing diseases or complications. So you have to manage all these things together, because nowadays it is not only one disease, it is a metabolic syndrome which involves many things, like your lipids who are deranged should be addressed, your uric acids are high, has to be controlled. If you have a sugar, then you control your sugar also. If simultaneously along with your lifestyle modification, these associated comorbidities should also be addressed, and then you have to take a comprehensive approach to this disease to prevent the short and the long term complications also. And there are the chances, if you follow these protocols and with the control or with the guidance of a healthcare proper provider and your doctor, then you can always control it also with the help of non-medical therapy also in the initial stages, or with the help of drugs. So it is very important to understand why blood pressure should be controlled, why this hypertension should be addressed, and what is the significance of this disease in a day-to-day life. So hypertension is a one disease which is basically affecting every part of your body. So if you have uncontrolled hypertension, then ultimately there is a continuous stress on your cardiovascular system. So your whole vasculature is under one kind of a stress. So whether it is a small microvasculature or it is a macrovascular, every part is affected. So chances of developing damage to your kidneys are very, very high. So this is a hypertension related of nephropathy. This is very, very important. Then comes the most important is heart failure. Gradually, with your heart has to pump against lot of resistance, peripheral resistance, then its walls become thick. So your left ventricle hypertrophy, so it predisposes to your heart failure also, heart attacks also. So you will have an increased heart rate also. So you will have a palpitation, arrhythmias, atrial fibrillation, that is heart becomes irregular. And then if consistently high blood pressure, then you can always have a brain stroke also. So beside heart problems, another important thing is brain stroke. So you can have either the brain vessels will stop, then it can cause infarct also. There can be brain hemorrhage also, which is a very, very common comorbidities which is found in hypertensive patient who has got severe hypertension. The commonest neurosurgical problem is hypertension related brain hemorrhages beside head injury. So, and it will also affect your eyes also. It can cause retinopathy, so you can be losing your vision also. Then you can have the peripheral vascular disease also. If at times if there is severe spasm of your peripheral vessels, it can lead to gangrene of your vessels or peripheral vascular, might lead to amputation also. So you can have effect of all your major organs, your brain, your heart, your kidneys also. And then if there is a heart failure, then the fluid will deposit in your lungs also, which on long basis, if you repeated heart failure, then it will weaken your lungs also. So just to conclude my presentation, hypertension is a disease which is quietly a deadly disease, which is not only disease, it is a highly prevalent disease also. So prevention, awareness and treatment, all three things are very important.